I'm Vikas Tayer. I head the international healthcare services for Manipal Hospitals in a group. Manipal Hospitals is not a new hospital. It's an 70-year-old hospitals group as a group. We started our journey with our first private medical college of India, which was started in 1953 by our philanthropist and chairman, Dr. T.M.A. Pai, which went to engineering colleges, MBA colleges, uh, hotel management colleges. So we started our journey with education, then in hospitals. Whereas Maldives has been concerned, we get a good number of patients from Maldives, not recently, but from decades, I would say that. It's not only, we get patients for all treatments, because Bangalore is a preferred destination, what I feel, because of lot of Maldivians students studying in colleges. So their, parents, if they want to have treatment, they prefer to come to Bangalore for the treatment. Apart from that, there is an, bilateral relationships also of Maldives and India. So we offer visa on arrival. So the patient don't need to go for visa and other things. But we prefer, if the patient is coming for a short treatment plan, so medical visa is preferred to be taken before they reach over here. Apart from Maldives, I've been to Maldives many a times, not only from this decade, from last decade also I've been traveling to Maldives. It's a beautiful country where I have seen, building of Hulu Male in front of me. There was a time when I used to land in, airport. Then you have to take a boat to reach to the Malay city where I used to stay, and most of the offices were there. So we have a good tie-up with all the insurance companies in Maldives, which starts from Asanda, which is a government insurance, and which is government-supported insurance. Most of the countries have NHS schemes, which is called National Health Scheme. Asanda is being covered from as NHS scheme. So the patient doesn't need to pay anything, as per my understanding. Then we have a tie-up with Solaris. We have a tie-up with Allied Insurance, Amanata Kafol, where we give a cashless treatment for the patients in whoever is coming to Manipal Hospitals, which covers all over India. It's not only Manipal, Bangalore. As Manipal hospitals, if I just give you a brief about Manipal Hospitals, we have around 27 hospitals in India with 7,600 beds in total, overall as a group. In Bangalore, we have around 11 hospitals in Karnataka region. We are there in Salem, Vijayawada, we are there in Jaipur, we are there in Delhi, we are there in North, we are there in East, West and South. So Manipal Hospital is now covering all over India. But yes, we see a lot of patients coming only for Bangalore hospitals because of the connectivity, better connectivity from Maldives to Bangalore. It's hardly a flight of 40 minutes or 1 hour 20 minutes kind of thing, which which is weekly. I guess every day now they have started the flights, and the cost is also not very high. It's a very minimal cost which is being charged for patients or anybody coming from Maldives. And Indians are also going to Maldives, so there is an inward and outward flow of the patients, what we see that. Mostly we see a lot of patients coming from Maldives for different kind of procedures, although we cover all specialties, which includes almost 53 specialties, including all specialties, right? But we have seen most of the patients who are coming over here are for cancer treatment. That might be because of genetical reasons. And what I have observed, and I have been in Malé and other places in Maldives, smoking is a little bit of a problem over there, which is seen very highly over there. I guess that is giving welcoming cancer to come in your life. But yes, of course, there are a lot of other cases also which come for genetical reasons also, and it's not that I should not be saying only smoking, but yes, there are other reasons also which. But we see a lot of patients from all these coming for cancer treatment. Then we get spine. We have bone marrow transplants patients coming. Good number of patients come for bone marrow transplants to our Manipal hospitals. And cardiac surgeries also, we have seen a couple of cases for cardiac surgeries. So these are the overall cases mainly we see. Although we cover all specialties, these are the major cases what we are seeing from Maldives. So if any patient is coming from Maldives, we provide end-to-end services. End-to-end services means that, right from the time they land in airport in Bangalore till the time they are back to their airport, we take care of everything. Our MIPC team, which is an operational team, which takes care of when you have sent a ticket or an arrival details to us, our person would be there to pick you up from the airport. Once they pick you up, they give you an phone. If you do not have a roaming or you want to talk to any of your relative, inform them that you have reached safely over there. After that, we arrange all the guest houses. There is an guest houses available. The cost may vary from $15 to $50, from $50 to $500 also, as per your pocket per day. Where the accommodation has been then appointment booking, the surgery booking, everything is being done end to end. Once after the surgery is being done, we also take teleconsultation. So we do not want the patient to come for a review. Not only for the review, before the surgery also, if the patient wants to have a teleconsultation, so he can have a teleconsultation with the doctor over here and inform and get informed about his surgery, that what are the surgeries, what we are going to do, what are the measures what we are going to take. Is it possible to do the surgery instead of doing surgery now, 3 months down the line? Is it possible that without surgery we can go for another 6 months on medication? So these are the things which would be helping the patient to understand his disease before he travels and goes for the treatment, full-fledged treatment.